Why do we do it that way? Why is it that we have devised a system, and it makes it sound like somebody sat down and figured it out and wrote it out and devised it, but of course that's not what happened. It evolved this way. Why did it evolve like this? What is the underlying basic flaw in the way we have thought about healthcare as a nation that is not true of any of the other first world nations? I think you can find it in this quote. I don't know if any of you remember Tony Snow. He was a syndicated columnist in the 90s when he wrote this, and he was writing it because there was a big to-do about the so-called Clinton healthcare plan. And he's a conservative, and so he's trying to advise us about why that was such a bad idea. Later, he became the spokesperson for the George W. Bush White House, the second Bush White House. While he was serving in that capacity, he developed colon cancer and subsequently died before George Bush finished his second term. This is what he said: "In the real world, people stampede when somebody slaps up a sign that reads free. This is the theory behind bargain basements, but it also applies to hip replacements and appendectomies." Okay, first of all, of course, he doesn't quite get what a hip replacement person can and can't do because they don't stampede anywhere, right? Right, so that's pretty obvious. But let me ask you a question. Have you ever known anyone who got an appendectomy because it was on sale? It's ludicrous. This is silly. This is nonsense. This is market speak. This is what we are always told. In fact, we're Americans, right? Shopping is the quintessential American experience. This is how we think. This is why it reverberates in our society when politicians stand up and tell us about, we just need more market forces. That is what they're saying. Because in a market, price determines demand. The higher the price, the lower the demand. And the lower the price, the higher the demand. And they keep thinking about healthcare in exactly those terms. They keep saying people have to have skin in the game. Another ludicrous statement because, of course, when you're at the doctor, your skin's in the game. All right? It's there already. But they keep saying that. Why? Because they keep trying to get us to understand that if we have an insurance product that shields us, which it never does anymore, from the real cost of the care, we'll want more care. That's what they call the moral hazard of the health insurance business model. Well, I've practiced primary care. I've taken care of people as an academic specialist in occupational lung diseases, and I've had a hard time convincing people to just let me do a blood stick because they don't want to get stuck by a needle once, much less get their belly torn open for an appendectomy. People don't seek care. They don't say, give me that, you know what, it's on sale this week, give me that chemotherapy. I'll drink it right now. If I were to offer two $50,000 items up here, one of them's an open heart surgery and the other's a BMW, and all you have to do is promise me that whichever one of those you choose, you go and take it right now. If it's the BMW, get the key and drive it off the lot. And if it's a heart surgery, you go with me to the hospital. We'll open your chest tomorrow morning. I've never yet had a member of an audience choose the heart surgery. Why? Because you're sitting here. You probably don't need open heart surgery tomorrow. If you do happen to need it, though, is there a price you wouldn't pay for it? Or if your child needs it? Price does not determine demand. Epidemiology determines demand in healthcare. The frequency of heart problems that need open heart surgery, that's what determines how many of those we do. And the frequency of appendicitis is what decides how many appendectomies there'll be, not the price. This is not a commodity. And market forces will never fix this. And every time you hear a politician give you a market line, you need to answer back and say, no, that's not how it works. It will never be fixed if we follow that. That is the underlying problem.